biomechanics sport project, we decided to investigate the role of the rotator cuff in tennis. The rotator cuff is made up of four muscles: the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. Each of these muscles serves a specific function, but for the purpose of our experiment, we will be focusing on the teres minor. The teres minor is a narrow, elongated muscle which originates from the lateral border and adjacent posterior surface of the corresponding scapula and inserts at the greater tubercle of the humerus and the posterior surface of the joint capsule. In other words, it's located at an angle to the shoulder and the back. The fibers of the teres minor run obliquely upwards and laterally. The upper fibers end in a tendon which is inserted into the lowest tubercle of the humerus, while the lower fibers are inserted directly into the humerus below. The tendon of the teres minor is connected to the posterior part of the capsule of the shoulder joint, allowing it to contribute to rotation of the shoulder. The axillary nerve crosses this muscle and forms a pseudoganglion here, which is an area that has nerve fibers but no nerve cells.
The teres minor moves the humerus through a lever system, with the shoulder joint as the fulcrum, the muscle providing the effort and the weight of the arm acting as the load. The teres minor allows the shoulder joint to rotate externally and internally. External rotation moves the arm away from the chest, while internal rotation is rotation towards the chest. In tennis, a forehand shot relies on the internal rotation, while a backhand shot uses external rotation. When the teres minor contracts, it applies a force at a certain distance from the shoulder, generating torque that causes the humerus to rotate. Since the muscle also does mechanical work, stronger contractions will result in a greater rotation. Because the humerus rotates around the shoulder joint, its movement depends on its moment of inertia, which depends on the mass of the arm and distance from the shoulder. A larger moment of inertia means there is more of a resistance to rotation, requiring a greater force to reduce movement. When doing a forehand in tennis, the teres minor is able to control the motion, helping to prevent strain on the shoulder. In a backhand, it contracts in order to generate torque and control the shot. In general, the teres minor helps to stabilize the shoulder and allow movement.
To demonstrate the function of the teres minor, we created an experiment where somebody applies different amounts of rotation when hitting a ball. We used 4 levels of rotation: no rotation, little rotation, medium rotation, and a lot of rotation. We did 2 trials for each experimental group, tracking where the ball landed after each hit and measuring the distance from the first bounce to the hitter. We found that with increased rotation from increased use of the teres minor, the ball traveled further. This is evidenced by the increasing distance between the hitter and the first bounce as the level of rotation increases.
The difference between the 2 trials was at most 5 Lenka feet, which were our measurement while we were at the tennis ball court, and this could be due to a number of error factors. The first one being the person spotting where the ball hit might have been a little bit off. The error was probably not a whole foot, but enough that it combined with the other factors and it may have changed the measurements slightly. Another factor of error could have been that Lenka was not going in a perfectly straight line from where the ball landed to the racket. They tried their best and the other people were spotting their route, but especially when the ball landed over 50 steps away, there may have been some error. And finally, the ball may have not hit each time or been hit each time with the same amount of force, and the ball may not have been thrown each time with the same amount of force. We attempted to standardize it by having the same person throw and the same person hit each time, but it's very hard to throw something or hit something with exactly the same strength. And that being said, at least on the hitting side, it was somewhat standardized by the experiment guidelines of how much rotation they were supposed to be doing with their arm. As for the physics of the experiment, there's a lot of physics concepts that could be explored in tennis, like moments of inertia, elastic impacts, and momentum, but we focused on kinetic energy and namely energy transfer. When you swing a racket, you are transferring kinetic energy from your arm, and by extension the racket, to the ball. Therefore, the more energy you put in your arm, the more you swing it, the more kinetic energy you are transferring, and the farther the ball will go. An equation we used here was kinetic energy is equal to 1/2 mv squared, and kinetic energy is the energy in joules, m is the mass of the ball, and v is the velocity of the ball after impact. The ball's velocity after the racket hits will depend on the speed of the racket at impact. So in our experiment, the ball goes farther when there's more rotation, more action from that rotator cuff, because the arm is moving faster by the time it reaches the ball, and therefore it's transferring more energy. The distance the ball travels will depend on its initial velocity, the launch angle, and the air resistance, but mainly its initial velocity. The initial velocity of the racket is what determines how far it goes, and this is evidenced by our experiment.